All right, so welcome. I want to welcome everyone to RVA Rapid Transit's Transit Talk. This is where every month we invite the general public, friends, transit advocates, planners, local leaders to talk about issues involving regional transportation for the Richmond, Virginia area. And my name is Faith Walker. I am the executive director for RVA Rapid Transit. For those of you who are just joining us for the first time, RVA Rapid Transit, we are a nonprofit here in the Richmond region. We advocate for frequent and far-reaching public transportation in the region. And we want to see that happen in multiple ways. So we want more buses to go more places, so out into the county lines. But we also want frequency. And then we also want people to have dignified places to wait on the bus. So we're advocating for shelters and benches, but also dignified and clean places to wait. And then the rider's voice. So we want to make sure that bus riders have the opportunity to participate in transportation planning and decision making. And then here recently, within the last 3 to 4 years since the pandemic, we have been really getting behind zero fare. We want the bus to continue to be free because of the economic, the environmental, the health benefits that the bus being free of any barriers as far as financial barriers getting on and off the bus. Again, I want to invite you all to our transit talk. I want to go over a few housekeeping notes. This is recorded. We want to definitely share this information for folks who weren't able to be here today, but we also want to make sure that we have a clean recording. So we will ask everyone to stay on mute. If you have a question, you can put them in the chat. So you can do hashtag Q to establish that you have a question. At the end of the presentation, we will open it up for Q&A and we'll make sure we read those questions. But by you putting hashtag Q, we know that that's a question. Throughout the event today, you can definitely make comments, your thoughts, but definitely make sure you put hashtag Q so that your question can be answered during that portion. All right, so to get started, I want to just go over what we do. We talk about the news. So what's happening in transit right now? What's up with the bus? So GRTC just had an amazing block party. They celebrated the expansion of Route 1 with a block party at St. Joseph's Villa here recently. And we attended, so this is the RVA Rapid Transit team in front of the Route 1 northbound bus. And it was really impactful to see. GRTC has had a record number of groundbreakings and ribbon cuttings. And so we got to hang out with them with ice cream and different treats at St. Joseph's Villa. I just wanted to tell you a little bit about Route 1. And one of the major themes of this expansion and RVA Rapid Transit's advocacy, we've been advocating for the bus to go to J. Sargent Reynolds. And guys, the bus goes to J. Sargent Reynolds. So we are extremely proud of that advocacy led by one of our board members and previous GRTC board president, Reverend Ben Campbell. So we're excited and we celebrated at that block party. Now the bus goes all the way to Reynolds Parham Road campus. And so it's every 15 minutes, Monday through Saturday through 7 p.m., which is amazing. And then every 30 minutes after 7 p.m. to midnight. And then on Sundays, it's every 60 minutes. And so as you can see, some of the major milestones and extensions is to St. Joseph's Villa and the Parham Road campus. So in the news. And then in the news, Stephanie, our programs and community engagement manager, hosted a meet and greet with bus riders. So our adopters program, Adopt a Stop, is growing leaps and bounds. And earlier this year, we hosted an award ceremony honoring these folks who have dedicated their time at least once a month cleaning a local bus stop, but also a lot more. And so we just did a meet and greet where they got to meet Stephanie. This is a role that she's just stepped into over the last quarter. And so they got to meet her, but also got to engage with other bus riders. It was a lot of fun. So if you're interested in ways that you can, if somebody can put that person on mute, I appreciate you. Ways that you can engage on how you can become an adopter, please reach out to Stephanie, okay? And then also, I wanted to make you aware that Henrico County is hosting listening sessions throughout the county. This is an opportunity where they want you to give your thoughts on what the future for the county should be. And all of you guys, of course, are on transportation or even advocates in your own right for whatever you want to see in the county. And this is the opportunity for you to do so. So I listed that information there. I believe that if you are not a part of our newsletter, I encourage you to join. We'll also add a link where you can join our newsletter, but we'll give this information out. But you can participate in a listening session at the Fairfield Library July 29th, at the Brooklyn Library July 30th, at the Tuckahoe Library the 8th and the 12th of August, and then Varina the 19th, and then Three Chop the 30th. And so this is an opportunity for you to give representatives or the county suggestions, especially when it comes to more sidewalks, more expansions. Where do you want buses to go? Where do you want microtransit to exist? So this is an opportunity for you to give your feedback and give your voice during these listening sessions. So I encourage anyone who is an Henrico County resident, or even if you work in Henrico County in these particular areas, to visit and go. So with that, I want to turn it over to Stephanie, our community engagement and programs manager, who's going to go over our Rider's Voice and tell you a little bit about what we do with the Rider's Voice. So Stephanie, go ahead and take it away.
Awesome. Thank you, Faith. And welcome, everyone. I'm really glad to be here with you. So we have been, of course, continuing our work of showing up at bus stops and talking to folks. We always bring water, we bring snacks and some food, and we really want to connect with people and hear what's going on at the ground level. How are people experiencing the bus? What's going well? What's not going well? So, of course, the biggest news I think for all of us here has been the heat. The heat has been absolutely wild and very challenging. So for bus-bound people, people who do not have an option to ride a car or can't afford Ubers and Lyfts, we have a great population of folks in the region who main transportation is the bus. So we tried to get out and just hear from them directly what's going on, what do they need right now. So with that, we've got a couple comments. We showed up at 23rd and Franklin, which is a very, very popular stop, and it sees a lot of traffic in and out, and there are no shelters there. So let's hear Beverly. Beverly was there. She was waiting on the bus. You can go ahead and play that, Faith.
Oh, yeah.
Thanks.
My name is Beverly. I ride the 12 bus and the 14 bus Monday through Friday. I also ride other buses. This bus stop at the 23rd and Franklin has no shade or any protection from the rain. I would like to see that fixed. I would like to see it cleaned up around here and the bricks replaced before somebody trips and falls and kills himself.
Yeah, so Beverly was talking about, some of the bricks right around the sidewalk there they're uneven. And I think that's the case for a lot of sidewalks in Richmond, as we know, and in the counties, where if there even are sidewalks when we get into the counties. So just thinking about all of those levels, and specifically at 23rd and Franklin, it's on a steep incline. So it's like quite a difficult place to catch the bus when you have over 100-degree temperatures. You're trying to go up a very steep incline, and there's uneven sidewalk to work with. It's really challenging. And another thing I'll say is that Courtney, our transit ambassador, and I, when we went out to speak with these folks, we noticed a lot of people were actually waiting at the Farm Fresh supermarket, which is right beside it around the corner, because there was a little bit of shade there. So people were kind of risking potentially missing their buses in order to find some relief in the shade, which I thought was very, very, very interesting. And then next up, we've got Carlos, and we met Carlos at Willow Lawn. So that's where this picture is from. It's actually the bus stop that Carlos is speaking about in this comment is that photo that you're seeing. Yeah, you can go ahead and play.
Yes, my name is Carlos. and I'm on bus route number 91, and it's hot. It's hot out here. It's very hot. You know what I mean? It's very hot, and the bus stop that I was standing at, it has no shelter, no shelter at all. So, what I want to ask the city or whoever controls the bus routes and the bus stops, can we please get some shelter around here? Some trees. Can we get some trees around the bus stop so we can get some shade? It is too big hot out here. Please. So
Yeah, and I just love Carlos's point of adding trees near bus stops, and I know that that's something that we advocate for. Is that I know we're in conversations even with the Department of Forestry. You know, this is a nationwide issue. These rising temperatures and how to mitigate heat, the heat island effect, but especially for folks who are out in the elements. Like I said, like bus riders tend to be walking from stop to stop. So planting trees can make a huge impact. In our state of transit report, we noticed that shelters that have, or I'm sorry, bus stops that have shelters can be 20 to 40 degrees cooler. So it's like very like the potential of power of a shelter or a tree. It's very it's big. So yeah, that's our Writer's Voice section today. And I'll turn it back over to you, Faith.
All right, thank you so much. I appreciate that and the incredible work you're doing in capturing those stories. So now what I want to do is I want to invite our special guest. Stephanie led us up to exactly what we're here to talk about. We've had record temperatures all over the United States, but even in Richmond of how hot it's been, and the timeliness of the report that was just put out by Peter Braun and as well as a good friend of ours, Dr. Jeremy Hoffman, that talks about the heat emergency in our region. And so today we have a special guest, Peter Braun, with the Richmond Health District, Richmond Henrico Health District, who's going to go into that incredible research paper that he's presented today. And it talks about the impacts of heat, but not only just at bus stops, but everywhere around the city. And so what I want to do is invite Peter on to talk about his work, his role, and the report. So welcome, Peter. Happy to have you.
Thank you, and thanks for such a great introduction, Faith and Stephanie. I love Writer's Voice. I think like it matters so much, and it gives so much good context to the work you're doing and the work that the health department's working on. So thank you for that. I am going to share my screen.
Stop sharing my screen. That way you can share.
So I can get started.
All right, take it away.
Are you seeing, does it look right, the view of the slide?
Yes, the view is perfect. Yes.
Okay, great. Well, I am Peter Braun. I am the Built Environment Policy Analyst at the Richmond and Henrico Health District. We are a local health district of the Virginia Department of Health. Basically, we are contracted by the city of Richmond and Henrico County to be their health department. And as the Built Environment Policy Analyst, I work on issues around climate and transportation, and how we can make improvements in those areas in ways that can support public health outcomes. And today I wanted to talk about how we can beat the heat at the bus stop and share some of my research that was recently published. And before I get to that paper, I wanted to sort of frame some of the work that's been happening in Richmond around climate and the urban heat island. So we're already feeling the impacts of climate change today in our community. Whereas today we might see about 10 to 20 days of extreme heat. So days with temperatures of 95 degrees or above. We might see 10 to 20 days in a summer. By the end of the century, we could see around 40, about double that, or even up to like 72 days of extreme heat if we stay on the track of higher emissions. And in cities in particular, we're already seeing increased temperature because of this phenomenon called the urban heat island effect. And urban heat islands are caused by structures such as buildings, roads, parking lots. All these stone and concrete and metal, all these materials can trap and hold onto heat in ways that natural environments don't normally do. So trees and forests and water bodies can shade communities. They can release heat through evaporation. Trees are sort of like a natural air conditioning. They basically sweat through their leaves to release heat. And in cities like Richmond, we just don't have enough trees to provide the cooling that we need. And then we've replaced it with all these built surfaces that trap heat. And if you've waited at a bus stop in Richmond, you know there's a lot of concrete around. You know there's probably not enough shade or trees around. And where I'm sitting in my office at the Richmond and Henrico Health District in downtown Richmond, we're surrounded by so many parking lots, so many surface level parking lots, and just not enough street trees. You can sort of see, I put a picture out the window from our conference room. There's parking lots as far as the eye can see, all the way to the downtown expressway. And there's a lot of space that's dedicated to single occupancy vehicle transportation. And there's a lot of other things we can do with this land, or at least ways that we can make it so that these areas aren't trapping and absorbing heat and exposing people to extreme heat. And there's been a lot of work on urban heat in Richmond. The Science Museum of Virginia sort of, I think, started the conversation around urban heat in Richmond. Jeremy Hoffman, one of the co-authors on the paper, led a community science initiative in 2017 at the Science Museum of Virginia, where volunteers went out with these little air temperature sensors attached to cars and went around our communities and our neighborhoods and our streets and collected all of these air temperature readings. And they collected all this data, put it together in this computer model that sort of mapped out where in Richmond are the hottest areas and where are we seeing cooling. And if you look at this map here, you can see this is from the 2017 heat mapping campaign, from Scott's Addition to downtown to Manchester, and then down like the Midlothian Turnpike corridor, Richmond Highway. You see all these red areas, all these areas with higher heat. And then in sort of like the west end and along the James River, you can see these blue areas, this stretch of cooler areas where plants and the river itself, all the trees and forests around it are actually cooling the air and providing that benefit to all these communities. And so there's some other research out there, I think also from Jeremy Hoffman, that looked at redlining, these areas that were historically discriminated against through housing practices and lack of investment, and these areas that had lower investment and are lacking trees and all these cooling amenities, they're going to have higher temperatures. And so this research has progressed for several years, and we wanted to know what are the main ways that heat is impacting our community. And the biggest way that across the country that we see is on public health. Public health is the most cited impact of extreme heat, and extreme heat is the deadliest US weather-related risk. Extreme heat accounts for a larger portion of the public health burden than all other natural disasters combined. It is worse for our communities than hurricanes and tornadoes and drought and flooding, all those things combined, it has a bigger impact. And one of the ways that we can measure this impact on our community is looking at heat-related illnesses. And a heat-related illness that includes things like heat cramps, heat exhaustion, heat stroke, or even death can occur when the body is unable to properly cool itself. And basically, the body's main way of cooling off is through sweating. And it's not just high temperatures that have an impact on the body's ability to cool itself, but humidity. On a day that there's really high humidity and high heat, your body can't cool itself off as easily. And so on days like that, or even if you're just outside for an extended period of time in moderate heat, you can experience a heat-related illness like heat exhaustion. And that feels like feeling faint or dizzy, excess sweating, muscle cramps, things like that. And so those are things to look out for if you are outside and starting to feel sick. And basically the actions that the health department recommends are to get to a cooler space, drink water, find any way that you can cool off. If symptoms for heat-related illness start to get really intense, that's when we start to say you need to call 911 and get a person to a cool place just to get their body cooling down quickly. Heat can also impact people with pre-existing health conditions. A person, say, with heart disease who's exposed to extreme heat can have other kinds of medical emergencies, can have a heart attack. People with asthma can struggle more with when exposed to extreme heat. So it's not just these few types of heat-related illnesses, it's also the way heat impacts us in other ways. So with this question in mind of how is heat impacting our community, a group of researchers got together when this started way back when I was a student at University of Richmond. But I worked with Todd Lookingbill and Beth Szamia from University of Richmond, Jeremy Hoffman from Groundwork USA, and then Jessica Rosner and Daisy Banta from the Virginia Department of Health Office of EMS. And we published this paper, A Heat Emergency, Urban Heat Exposure and Access to Refuge. How can we measure the public health impact of extreme heat? Who's most impacted? Can people protect themselves, and how can our local government help protect people from extreme heat, including ways that we can fill in those gaps? And so this paper, the main data set that we looked at was heat-related illness emergency response incidents. So that means anytime in Virginia, if somebody calls 911 for an ambulance to come, there's a record of that in the Virginia Department of Health's EMS system. And basically you can query, you can search through that database for any time that someone called 911 because of heat stroke, heat exhaustion, etc., any of these heat-related illnesses. So that was the data that we were looking at. And we looked at it specifically in the city of Richmond from 2016 to 2022. So that's 7 years of data. And so on the left here, you can see that data plotted out from across several years. And over that time period, Richmond saw an average number of 70 heat-related illness EMS incidents, but that's likely an underestimate. There's a lot of people who are just not going to call 911 for a lot of reasons. You know, if they don't have insurance, if they're struggling financially, they might not want to call 911 and have to pay a lot of people who aren't going to call 911, they might just drive to an emergency department or find their way to an emergency room some other way. And you can see on the right, data from emergency rooms is much higher. But the reason we looked at EMS data was because you can see where those incidents are happening. So there's an actual location associated with each call. And we'll get to some maps of that later. We also were able to look at when these calls were coming in. So the peak for heat-related illnesses in Richmond is July, about mid-July. And the peak time of day is about 3 p.m., so all through the mid-afternoon. It was important to know that they weren't happening at night because there is some evidence that other kinds of shelter resources, especially for people experiencing homelessness, can be really important at night to protect them from heat-related illnesses. And then we were looking at who is most impacted in Richmond, and we found that heat-related illnesses disproportionately impact Black and African American residents more than white residents are impacted by this. Inequities that show up in Richmond. Richmond's Black community is impacted by a lot of chronic health conditions and experience worse health outcomes.
Hey, Peter, you are freezing a
Yeah.
bit. You're freezing a little bit.
Oh, I'm sorry.
Yeah, and I think it maybe could be the bandwidth or
I could turn off my camera for now to see if that helps.
yeah. Let's try without, we would love to see your face through the recording, but let's maybe try without the camera for a little bit to see if we have any relief, and then bring you back on if there's a difference. But thank you.
Can you still hear me?
You just started. So if you were speaking 2 seconds ago, no. So just go ahead and continue without the camera.
Can you say that again? Because I didn't hear you either.
I can hear you now. So let's try without the camera.
Okay. So continuing to look at who is impacted by heat-related illnesses, we also saw that older Richmonders, people over the age of 50, were disproportionately impacted, as well as and that shows that a lot of the older people that are also experiencing these so have a lot of other pre-existing conditions or worsening health are maybe more. We found that there were several risk factors associated with heat-related illness in Richmond, including alcohol and substance use, mental health or cognitive issues. So these are when an EMS clinician shows up to a 911 response, they can list out some of these additional things that they found, and that some of the most vulnerable people in Richmond, heat-related illness, particularly people who are experiencing homelessness. And that sort of points to the resources that we might need in Richmond. We also found that heat-related illnesses can happen as people are going about their daily life. Attending an outdoor event, exercising, doing chores or yard work, it can really. We also looked at where heat-related illnesses are happening in Richmond, and we found that the hottest place in Richmond are seeing the most heat-related illnesses. I think in general, I've gotten this sort of, of course there are, of course there are more heat-related illnesses in these places that are hottest. But we really do need to know whether that's true or not, because that could at the city where,
Hey, Peter,
yeah,
it is not it seems like it's getting worse, and this is such powerful information. So I'm
okay,
gonna stop recording.
spotty Wi-Fi here.
Yeah. If we can maybe try to, if you can move to another place in the building, and then um I'm gonna bear with us, our friends that are listening. I'm gonna stop recording just a second.
All right. So just to reiterate where we were, because it was a little bit spotty there, we found that there were a couple risk factors associated with heat-related illnesses, including alcohol and substance use, as well as homelessness. And seeing that homelessness shows up in this data so much, it means to me that some of the most vulnerable people in Richmond are experiencing the worst health outcomes due to heat. And that's pretty serious to me. But that also means, well, we also saw that heat-related illnesses can happen to anyone while going about their daily life. We see that heat-related illness can impact people while at work, while attending an outdoor event, exercising, doing chores or yard work, just basically being outside, going about your daily life, which means that this is an issue that a lot of people need to be aware of. We also saw that the hottest places in Richmond saw the highest levels of heat-related illnesses. And that's sort of like I've gotten some reactions like, duh, of course the hottest areas are going to have the highest number of heat-related illnesses. But because we work at the health department, and a lot of our government agencies and departments have to make data-driven decisions, we needed to know if that was true. We couldn't just go off of that assumption. And so that builds the case for why all these interventions are really important to protect people from heat. And it also, I think, looking at heat-related illnesses, it humanizes the data. It shows that this is an impact on real people in our community. People are getting sick while waiting for the bus, while going about their daily life. And it also means that our solutions that we implement need to be human scale as well. By human scale, I mean, what can we do for the actual person? Can we get them a bus shelter? Can we get them access to a cooling center where they can go during the day on days that it's really hot? But it shows the impact on public health. And sort of zooming in on this map on the screen here of the number of heat-related illnesses by census tract, you can see that the area, and I'll see if you can see my cursor here, but this area encompassing Scott's Addition and the Diamond District, and then this census tract encompassing Jackson Ward, were two of the areas with the highest number of heat-related illnesses. You can also see that Manchester and parts of Southside had a lot of heat-related illnesses, as well as downtown Richmond. And so we know who is most vulnerable to heat-related illnesses, and we know where those heat-related illnesses are happening. So the Center for American Progress sort of summarized this pretty nicely. The risk of heat-related illness intensifies when vulnerable populations or people are concentrated in vulnerable places. So how can we address individual vulnerability and then also make our places more resilient. And there are two strategies or two approaches, two main buckets of strategies that we can use. One is heat management, and that's the way that we can cool people when it's really hot out. How can we make sure people are safe? And then heat mitigation is how can we actually make our community cooler? How can we cool the environment through planting trees, removing concrete, all those things. And in Richmond, one of the strategies that the city uses, and similar to a lot of other localities like Henrico County and cities across the country, are cooling centers. And cooling centers are at a minimum, are public places that are indoors that have free access. They have air conditioning, free water, and bathrooms. But they can also have more than just those basic amenities. For example, in Richmond, all 9 Richmond public libraries are open as cooling centers. And you can do a lot more at a library than you could at just, any old building with air conditioning and water. It's a much more inviting space, and people can access more resources. You can use the computers at the libraries. You can check out a book. You can use the computers to access all kinds of resources. In Richmond, there are also 2 social services buildings that are designated cooling sites, and then there's the inclement weather shelter. And so in this study, we looked at where these cooling centers are in Richmond in relation to areas with more heat-related illnesses. And we found that even though there are a lot of cooling centers in Richmond, there are still a lot of heat-related illnesses, a lot of people getting sick just within a short walking distance from these cooling centers. And we wanted to know why that is. And we don't exactly have answers, but we do have a few thoughts about that. One is awareness. Do people know that these cooling centers exist? Is there enough communication about where these are and how to access them? Do people have transportation to get there? It could be as simple as, are there sidewalks in your neighborhood? Do you feel safe leaving your house during a heat wave, walking down a road that has no street trees, no sidewalks, to get to a cooling center? And are these places accessible by the bus? And then are they also places that are trusted? Do people feel comfortable and welcome going to a cooling center? Is there trust with local government? All of those questions come up. So on this map, you can see the libraries and cooling centers and other cooling centers that are currently open to the public this summer. And then in green, you can see community centers, which aren't designated as cooling centers in Richmond, but some other localities do use community centers as cooling sites. And so we wanted to know, where are these gaps in access? So the blobby shapes around each of these points are the areas that a person could walk to in 15 minutes. So if there's a gap between walk areas or walk zones, that means maybe we could fill that in with one of these green spots, these green community centers. I think one interesting thing about this map is that in Southside in particular, you see the areas around each of the community centers or cooling centers are sort of more blobby shaped. They don't look regular. And that means that there's disconnected sidewalks. There's less connectivity and less ability to walk to these places in Southside. So there's this missing infrastructure. So even if you opened another cooling center in Southside, would people be able to get there just by walking? And one of the last analyses we did in this paper was looking at another opportunity for cooling, which would be bus shelters. And so we looked at the proximity of all GRTC bus stops in Richmond and their distance to the nearest heat-related illness. And about 40% of the reported heat-related illnesses were occurring within 300 feet of a GRTC bus stop. And while we can't say that a lack of bus shelters is the cause of any heat-related illness, we can say that the fact that, well, when this study was done, only 5% of GRTC bus stops had a shelter. That's a big missed opportunity. Bus shelters could be acting as this opportunity for people to cool down and find shelter during extreme heat. It's not everything, but imagine you're walking down the street and you're starting to feel sick and you just need a rest before you get to your destination. If there's a bus shelter nearby, you can stop there for a minute in the shade. Or if you're a rider waiting for the bus, then you are for 15 or 30 minutes, then you aren't exposed to nearly as much heat. And RVA Rapid Transit knows this. One of our co-authors, Jeremy Hoffman, worked with RVA Rapid Transit to do this some like preliminary analysis. What's the word? Some of this testing to see what's the difference in temperature at a bus stop with a shelter versus without one. And there was a difference of up to 20 to 40 degree difference at shelters or bus stops with a shelter versus without. And that means that the experience of a person waiting at a bus shelter or a bus stop with or without one can be completely different based on whether there's a shelter there. And if there are trees around as well, in addition to the shelter to provide shade, it could be even cooler. And there's been some progress on implementing these shelters in Richmond. Correct me if I'm wrong, Faith, but I think the last I heard was 18% of bus stops now have shelters. That's up from 5%. And there's a goal of at least 75% of stops to have a shelter or seating by 2027. So I think that's pretty big progress. And I'm hoping that there's just going to be more investment in this important solution in the future. So how do all these things come together? How can we leverage bus shelters, buses, and cooling centers together to make sure that a person can get from point A to point B without being exposed to extreme heat during a heat wave? If a bus stop has a shelter, if a person can ride the bus that has AC, I think that that's one of the biggest opportunities right now, is that GRTC bus service is zero fare and every GRTC bus is air conditioned. So if you can go from a sheltered bus stop to an air conditioned bus to a cooling center, there's this distributed network of all these places to cool off across the city. And I think that all those pieces working together is really important. And I'm hoping that you all have gotten something from this, and I'm hoping that this research can inform all the conversations we're having with the City of Richmond and all of our partners. And thank you for tuning in and listening.
Oh, Peter, this was amazing information. This was great. I thoroughly enjoyed it, and I'm sure everyone on the call has as well. And yes, you transitioning to the new network worked well. If you want to try not sharing your screen and maybe we can do some questions, I think, yeah, this was great. And Matt says, thank you. Great work.
Problem. I can't find my stop screen share button, but
No worries. All right, so folks with questions, you can go ahead and push #Q for the questions. I was curious. There was the blue one, I guess a cooling center. I think it was along Hall Street. Do you know what that is? What place? What is the cooling center? The name of the cooling?
On Hull Street,
Mhm.
I think that's the South Side Community
Community?
Services Building.
Oh, yeah. Okay.
Mhm.
Okay. I was just trying to see because there was, as you can see, there was a big gap in people getting relief up and down Hall Street. And I was just wondering how long did they have to get relief? So that would be Southside Plaza, basically.
Mhm.
And them getting relief. And even we're working on a project now to get some assistance in Southside Plaza being the highest connection south. More shade and mitigate. So any questions? So you can go ahead and push hashtag Q. You don't have to even push hashtag Q. If you have any questions for Peter in relating to this research, very well done. I'm excited to continue the partnership and to continue the advocacy when it comes to advocating for more cooling zones. And then one of the things that you mentioned is how zero fare is in free buses. There's no barrier right now for people on all income levels to use public transportation. And so how buses is a connection point to these cooling zones, I think is pretty genius. Yeah. And I think if more people knew, unfortunately, Peter, a lot of people don't know the bus is free still. You'd be surprised how people don't realize that the bus is free now. So it's pretty interesting.
Absolutely.
All right, I got a question from Courtney. Did you all look at alternative shade methods at and around bus stops? If so, which were the most effective?
That's a really good question. We didn't look at any like particular types of shading. We just looked at sort of like the gaps in um, where there were shelters at all. But I think that that's a really important next step. One thing that I know the City of Richmond's Office of Sustainability is working on is implementing a whole section of RVA Green 2050 and working on a heat resilience plan. And I think that plan is going to look at all these different types of cooling and shade that we can provide in the city. Yeah, but I know that there are some trade-offs, at least from shade from trees versus a built structure, like an actual bus stop shelter. Trees can be really great for cooling, but you don't get the same shelter from rain. So there's that trade-off.
Mm-hmm. And is there anything happening right now in other cities where they're combining shelter and trees? Do you know of?
Um, Not that I know of, but I don't see any reason why Richmond couldn't do that. Um, I know that the city's sort of looking into the idea of how can we do more depaving? So if it's a whole concrete slab up and down the sidewalk, but there's room for a tree well and room for a bus stop shelter, why not install both? Why not plant a tree and put a bus shelter there?
Is there any other type of material other than concrete, painting the concrete? What other methods? Like we have all of this infrastructure now. Is there anything we can do?
Yeah. Yes. Daniel said in the chat, depave it to save it. Totally agree. I was hoping I could present on the other piece of the puzzle, which is the heat mitigation strategies. But that would take another 20 minutes to go through all those different.
We do a part two of this.
That would be great. I would love that. But yes, there are lots of different materials you can use. You can use, I don't know if you've heard of like permeable pavement. That's like pavement that can let water seep through, and it can also let water evaporate through, and that can sort of cool the air in another way. You can paint You can paint streets, you can paint sidewalks, you can paint roofs, lighter colors, and they'll trap less heat. So other cities have whole programs on cool streets and surfaces.
So we have maybe one more minute, and I can combine these questions, but can you just talk about, is there any efforts now with this heat mitigation in the counties and the cities, and what can folks do on this call right now to sort of push this along?
Yeah, so I know that both Henrico and Chesterfield are also thinking about this. I was just on a call yesterday with Plan RVA. That's the regional planning district for the Richmond region, and it includes the city of Richmond and a bunch of surrounding counties. And they just released all of these data models that show basically the urban heat island across the whole region. And so I think that is going to be a really important tool for planning in the counties. I know from some of the work that I do with Henrico that they're working on some reforestation efforts at local parks. And there's some efforts to get more homeowners to keep their trees, don't cut them down, even if raking the leaves is a pain. But there's these both cultural change and government change that can happen in all the surrounding counties and in the city. Yes, urban heat is an issue in the counties as well as the city. Just because it's called an urban heat island doesn't mean it doesn't impact suburban areas.
Well, thank you so much, Peter. We can definitely consider a part two. This was a very interesting topic and a popular topic. We had so thank you again for participating. All right. I want to go into closing. I want to invite you all to our next month's transit talk. Is going to be GRTC's 10-year plan. So what does GRTC have in mind for the next 10 years? Give me a second, y'all. I don't want my computer to down. So what GRTC is planning for the next 10 years, GRTC this last board meeting just approved their next 10-year plan. If you all responded to a survey that happened later in the fall of 2023, where you were asked, hey, where do you want lines extended to? Do you want this route to operate every 10 minutes or every 15 minutes? Do you want more service up and down Mechanicsville Turnpike? Do you want more service in Fulton? What does that look like? Do you want a bus to go here? You answered all of those questions. Now GRTC has, and their consultants have compiled it and mapped out what they're going to do over the next 10 years. So you don't want to miss that. We're going to put that in the chat so you can go ahead and register for that. So I want to tell you guys, thank you so much for joining us. If you are not riding the bus, ride the bus. Support transit by using transit, and then also adopt a stop. Regularly maintain bus stops in your neighborhood. You can partner with your civic association, your church, and reach out to us about adopting a stop. And then also share your story. So there is a lot of comments that we submit directly to GRTC and their board related to your experiences as a bus rider. So we want to hear those stories. So you can call 804-286-0007 and leave a voice message. And then also donate. If you found value within this information today, your donations help us continue the work of advocating to mitigate heat exposure with programs like this, but also our incredible work with engaging bus riders, our state of transit. So we need your support. So consider becoming a donor, but also a monthly donor. And then also join our newsletter. So with that, we'll see you next time for the next RVA Rapid Transit Talk. Thank you so much for joining us. Have a good one.
Thanks, y'all.
Thank you.